Right. Welcome, everyone. We have a great topic today. I don't know if you know this, but we have a great gem in our Baltimore County Public Libraries, and that is the power of the social workers. If you do not know about social work, oh, they are like the master key, the skeleton keys to all resources. Without further ado, I'd like to introduce Ellie, who's with us today to really talk a little bit more about this wonderful resources in our community.
Yeah, so thank you so much for having us. We're excited to be presenting to you today. I'm joined by my colleague, Asma Kayumi, and I'll just invite her to introduce herself, then I'll introduce myself, and then we can really get going.
Yeah, hi everyone. My name is Asma. I'm one of the social workers. I work out of the Woodlawn and Randallstown branches. I'm happy to be here. Thanks for having us. A little bit about my background. I've been a social worker for about 5.5 years, and I've worked in a lot of different settings, in school, in private practice, in the hospital. And I'm excited to be here as part of the library as a social worker. So thanks for having me and excited to have this conversation.
Thanks, Esma. A little bit about my background as well as I've been with the library for a little over a year now as a social work supervisor. But I come primarily from like a background of providing homeless services. I worked in New York City in homeless outreach for a few years before going to grad school. And I worked for healthcare for the homeless in Baltimore City for a little over 6 years, and then most recently with Johns Hopkins, providing outpatient mental health care. So both Esma and I bring a lot of direct experience to this role and to this program, and we're really excited to tell you a little bit about what the library does and what social workers do in the library. So what we really like to start with is by sharing a little bit about what social work is. Many people connect with social workers during really difficult moments of their life. This could be in the hospital, in the schools, or in the community. Social workers are professionals who receive training in clinical work and in broader community work. To me, this often translates to being in a field where people can both see the forests and the trees. We understand people and their experiences through different lenses, like how people may interact with the world based on their current stage of human development or through their family systems. Social workers look at people's strengths and inner capacity to address the issues that they face. And we recognize that people have the right to make their own decisions. And it's our role to facilitate, guide, and contextualize these issues, helping people look at what the issues mean for them and help determine what to do next. So the question then is often, how does social work fit into the library? Well, we found our libraries and social work are really nice complements to one another. Libraries are these amazing spaces that offer communities many different types of resources, from information to gathering spaces to reading programs to trying out new technologies. Libraries are fiercely committed to your intellectual freedom and to your privacy. And what we've found is that when libraries are trusted places in their communities, people come to them in times of need and times when they have questions about other supports that may exist. This is where we see the social workers coming in. Across the country and in other parts of the world, libraries and social workers are partnering to provide a different type of support. What we're doing in Baltimore County is bringing social workers into the branches where we have seen more of these requests appear. By doing so, we're hoping to support communities in accessing benefits, programs, and resources so that more people have what they need for healthy lives. So our social workers are library employees, which means that we operate within the library system as a library service. This also means that we don't have access to the databases that are at other agencies like the Department of Social Services or Social Security or doctor's offices. We can help people, though, apply for benefits at these agencies and troubleshoot when things don't go according to plan. We can also help customers who have a lot of different concerns look at the big picture and decide what step to take next and where they can get what they need in the community. We have partners with other local organizations that offer food, clothing, and other material needs. What we can't do is a bit more specific. So while we're skilled clinicians, we are not providing mental health treatment or or ongoing case management. This can translate into not keeping copies of documents for our customers who come in and not providing ongoing support for mental health needs. What we can do is help people get connected to those services in the communities where people live. We are also limited to providing support only to individuals over the age of 13, although we welcome working with families together. And social workers are mandated reporters in the state of Maryland, which means that we have to report any suspected abuse or neglect of a child or vulnerable adult in the community. And we share all of this so that people can know what they can expect of us and know what our limitations are. So if they have additional questions, we can be clear at the starting point.
Okay, so how does this work? Our service offers one-on-one private appointments in the library, providing advising and support and connecting individuals with local resources. So right now we have same-day appointments in the morning and scheduled appointments in the afternoon. And it's really the goal of that is so that people have the chance to plan around jobs, childcare, other responsibilities. And then the same day appointments are available so that folks can kind of get the support they need in the next day. Customers can call the library to schedule an appointment or to confirm availability, and our regular hours are listed on the library website. So we have this little diagram here. So this is kind of how we envision our services. It kind of looks like a boomerang. So we have the person in the center. We have a customer with a need who comes into the branch for support. We want to catch them gently and help connect them to where that support exists. So in this example here, if a customer comes in and shares that they don't have access to food, possibly because of lack of funds or not having a place to store food or another reason, we can help them learn where their local food pantries are, help them apply for SNAP or food stamp benefits, or learn where warm meals are available every day. And then once they have this in place, we can then talk about what the root causes of these root causes are of that access to food. So are they experiencing homelessness? Do they have difficulties at home? Are there medical issues? Which means they may need certain types of food or nutrition, which may be harder to get. Is transportation a concern? So we have a lot of potential questions whose answers can provide a lot of different pathways for support. We have a whole list of topics available that we can help customers with. We have resources for all sorts of needs. And so that might be medical conditions, crisis hotlines, childcare scholarships, law clinics, mental health, substance use treatment. And chances are that if there's a question, we have a sense of where to turn to for that answer if we haven't already, if we're not familiar with it. We know kind of where to go for it. When people come to us, they can expect that we'll go over their concerns and kind of complete like a mini assessment, which is a list of concerns they may have. We'll talk about what the top priority is for that meeting and then come up with a plan. We take direction from our customers and we'll share feedback as we work towards a plan. And so in general, the goal of our social work program in the library is to be a community resource. Okay. And then how can you request services? So customers can request appointments by contacting their local branch for a referral or by calling one of our active service locations, which are Woodlawn and Randallstown. You can also request services by reaching out to our email, socialworker@bcpl.net. That comes directly to Ellie and I, and then we can reach out and set up a time to talk about what some of the needs are and how we can help. And then there's more information available on our website, bcpl.info/services/social worker. And then these are our current hours. So our same day appointments are generally available during these times. So I'm at Woodlawn on Tuesdays and Fridays. And our same day appointments are usually between the hours of 9 and 11. and then appointments are available between 1:30 and 4. And then that's the branch phone number for Woodlawn that you can reach out to make an appointment. And then for Randallstown, I'm there on Wednesdays and Thursdays. Same day appointments are available between 9 and 11, and appointments are available between 1:30 and 4. And then that's the branch number for Randallstown.
And I'll just say that we are, excuse me, Woodlawn is going to be closing at the end of this month for a renovation, and they'll be moving into a temporary location very close to where the current branch is. And so some of our hours and the location specifically will be changing. So it's always best practice to check the library website if or to call the branch if you're looking to confirm our availability or to make sure that you are going to where we are on that specific day. So,
And
okay.
oh, sorry, Ellie. I just saw a question pop up that I felt like was related to some of the hours. And so, while I am at Woodlawn and Randallstown in person, we do offer support via phone or over a virtual appointment on Zoom as well. So that is something that we can set up as well.
So one thing that we've also been highlighting as part of our presentations to the community are library programs that are coming up in the coming weeks. We recognize that there's quite a lot that the library is doing, and we want to make sure that we're highlighting some of the things that are happening in the branches outside of our social work service that are also focused on community health and well-being. So this is just a small selection. If you're interested in getting more of these events, folks are welcome to email me directly at ecamlin@bcpl.net to sign up for our library social work newsletter. These come out once a month, and we share them with the hopes that by doing so, it's going to be putting the information into the hands of the people who would maybe benefit in that moment or would be interested in learning more. So some of the small selection that we have are computers for beginners, navigating Windows at the White Marsh branch on the 16th. On the 17th, we have a presentation called Be a Scam Buster at the Perry Hall branch. On the 17th, we also have CCBC folks who are trained in helping people navigate and apply for SNAP benefits. SNAP is also the name for food stamps at the Loch Raven branch. On the 18th, the Catonsville branch is hosting a program called Help Build a Welcome Blanket for new Americans in the community. On the 22nd, and this is a program that happens at multiple days across multiple branches, but the Department of Health is going to be hosting a table for their tobacco cessation program at the Reisterstown branch. On the 26th, we have chair yoga for beginners at the Hereford branch. And on the 26th, we have Community Shred Day at the Loch Raven branch, which is an opportunity for community members to bring 3 boxes of papers and materials that they may have personal identifying information on it to be shredded by like a large company that will be collecting multiple peoples to shred them professionally. And the library has contracted that service specifically for the community. And then there's 2 other, like a little bit outside of just general health and well-being programs that I wanted to make sure to share since they're happening soon. One is that the library is going to be hosting music performances at different branches on Sundays to celebrate the restart of our Sunday hours. The link is going to be in this presentation for those, which we'll be sharing out so that everyone is able to just click right on that. And then in October, the North Point branch is going to be hosting a program called 2 Truths and a Lie, which is a 3-week program that's going to be bringing folks in to talk about mis and disinformation and how to address it in your communities. So I invite you to always check out the library's event page. It has lots of information. But if you'd like to make sure that you're getting this particular selection, again, we invite you to email us to stay connected and to be able to get this regular newsletter. So we're done with telling you about what we do, but we're happy to answer any questions that you may have that came up during this presentation, or if there's specific things that you're wondering about what's happening more broadly related to social work practice. Thanks for being with us today.
One question, if you don't mind, the newsletter, will it also include information about any Zoom programs that are available through the Baltimore County Libraries?
So the newsletter will be focused on programs related to community health and well-being, and will include virtual programs that are kind of within that topic, as well as our in-person. We just didn't have any virtual programs that were coming up in the next 2 weeks from the newsletter that I had pulled together already, but they certainly do happen.
Okay, I don't drive anymore, so
Hmm. Oh, that's why they definitely enjoy hosting virtual programs. There are a number of virtual programs that happen that don't kind of fall within this particular category. So you can always go to the library event page. And Asma, do you maybe mind dropping the link in the chat? Because you can search specifically for virtual programs by doing that and see what's available. And then when you register, they'll send you an email with the Zoom link, which is a very helpful way to remember that you have something on your calendar coming up.
okay, thank you.
Hmm.
Hi, I have a question, and that is, do you guys work for the library or for the state or both?
So we are library employees. We are hired by the library and we work specifically for the library, which means that we follow the library's rules and regulations, and have some of the additional like kind of privacy protections because of the laws the libraries have to follow. Um, but and because of that, we are not working in the same databases as the folks who work for the Department of Social Services, for example. We don't work for a different state agency. We're very specifically library employees.
Okay, and that was my second question. You already answered that. I couldn't figure out, you know, if you guys had access to the
Hmm.
state system or whatever. Okay, but you
Yeah,
do have
and
a wealth of information.
we
Okay.
do.
I
And
actually have an appointment with someone tomorrow. I don't
okay.
remember who, at Randallstown.
It is probably with me, so I look forward to the appointment.
Okay.
And that's one thing that we like to make sure that people know is that we're not part of a different agency or organization, so we don't have access to that information. And we do sometimes get people looking and like contacting us thinking that we're with one organization and not the other. But when
Right.
we get those types of calls, we'll try and be as helpful as we can to say, this is who you're looking for. This is what I suggest that you do when you call and talk to them, or the types of questions to be able to ask. Because we know it can be really frustrating to feel like you're spinning around and trying to find exactly the right place and the right person.
And do the
So
right
we
thing.
exactly. So we are happy to always like even if folks weren't looking to connect with us in the first place, if they find us, we're happy to talk to them and to give the information that we can to hopefully smooth things out a little bit. And but everything's pretty complicated. And we recognize that that can, make life just more difficult than it really needs to be.
Yes, it has been for me. I don't, um,
Yes.
Before, like, without getting into detail, since this is being recorded, I just say that I can understand, and I wish that
it
things
is
were easier.
frustrating,
Yeah.
especially when you make a mistake. It's frustrating
Hmm.
because
Mhm.
you ask to look at, I don't know. Anyway, it's frustrating.
Yes. Spend many, many hours sitting on a phone listening to a machine asking you questions that you can't answer.
Mm.
And sometimes in person.
Or in person, yes, sometimes in person.
Well, if I can give a plug for us, we don't use machines too much when we're sitting and directly talking with folks, other than when we're trying to help them get connected to folks on the other side of it. So it's we have a pretty short time frame from when people reach out to us to when they get to hear a real human voice on the other side of it.
Yay.
Okay.
May I ask a question? I mean, on the same vein of frustration, right? I get the phone calls, and I don't even know how they find me as a virtual senior
Mhm.
center, but and it's always in a place of that frustration of I've gotten a new diagnosis and I don't know what the next step is. Um, my husband is now declining and he got a new diagnosis and I don't know where to start. I'm a caregiver, like all of these. Outside of the Baltimore County Department of Aging resources, can we also, like, would that be a good place to land to get people to land is with you as well?
So I think it really depends probably on the situation, but without knowing kind of all the ins and outs, people, you can refer people to connect with us, and we'll do our best to kind of lead them through with what we know and what we have access to. Um, I'll say that like we've talked to a lot of different people, and Usma's talked to even more than me. So we have navigated a lot of complicated situations, and sometimes what we end up doing is sharing that the place really to start is back with someone's medical provider. But what we can do, and part of that is saying like who you should be talking to in your medical provider's office. Here are some of the questions that I would suggest asking. And here's what I expect might be the next step, or here is how you can self-advocate for yourself and like within this particular direction. But we may not have all the resources or all the information that sometimes being able to get people connected to those programs that they may need. A lot of times the referrals have to come from a medical provider's office because they can check off saying, I confirm this is a diagnosis. I confirm that this is the level of care that's needed. I can confirm that, I'm telling the insurance companies that they should cover something when the insurance companies are sometimes happy to say that they don't want to. And all of that is going to be much more successful when it's coming from the medical provider's office than someone like us who doesn't have access to that information. But as part of that, we can talk to people about what that process looks like. I think it can just feel sometimes overwhelming for folks if they're looking for an immediate solution to find that there's another person or another step in between. So we try and help people understand that we're here to support, but we may not be able to do everything. So it's kind of like, what can we do within our role to help you get to the next step
Right.
with better,
And sometimes that
better
support just looks like
preparation
a
and
map.
information. Yeah,
Yeah, it
exactly.
looks like a map. Yeah.
Yeah.
Thank you.
Just having an idea about what questions to ask your doctor
Mm-hmm.
is a first step because a lot of times they give you a diagnosis and you have no idea what to even ask them about.
Mm-hmm.
True.
So appreciate that.
No, it's a pretty overwhelming experience to have a lot of new information, presented to you, and then sometimes it's the end of your appointment and it's left with saying, well, what does that mean for my life right now?
Hmm.
And those questions or feelings can come up later, and it's not always easy to get into the doctor's office. So if
Hmm.
it's helpful to call someone like us, that's also part of why we're here. We're really wanting to be involved and present for the community in the ways that we can. And we also try to be really clear with the ways that we can't so that there's not a lot of confusion, even if there sometimes can be disappointment with that.
Thank you very much. I really
Yeah.
appreciate the information.
Well, thank you for joining us today.
And we can't wait to share this video and more information about what services you provide. So thank you very much.
It's been our pleasure to meet with you this afternoon. So thank you. Thanks for having us.
Yes, thanks so much. It was so nice to speak to you all.